Good morning to all. So I'm presenting a case of a TASS following IPCL implantation in a myopic eye. So as we all know, TASS or toxic anterior segment syndrome is a rare condition characterized by postoperative inflammation after uneventful anterior segment surgery that occurs within the first 12 to 48 hours after surgery. Several etiologies, including retained lens material, viscosurgical devices, glove talc, intracameral antibiotics, and endotoxin contamination of BSS have been identified. So our case, it was a 27-year-old male patient who underwent IPCL implantation in the left eye for high myopia, presented with complaints of diminution of vision, redness, and mild pain 4 days following surgery. Surgery was uneventful and patient had vision of 20/30 on postoperative day 1. So on ocular examination, visual acuity was 20/600 and anterior segment examination under slit lamp showed mild corneal edema, anterior chamber cells and flare, dilated pupil with perimembrane and hypopyon. Intraocular pressure was elevated and B-scan ultrasonography showed moderate echoes suggestive of inflammation. Patient was started on topical antibiotics and anti-glaucoma medications. He was also given intravitreal antibiotics under topical anesthesia, and AC tap was also done in the same sitting. The AC tap, although did not show any microorganisms in the gram stain or the culture in the next 48 hours. Following this, the patient was started on topical and oral steroids along with previous medications on the basis of TASS, diagnosis of TASS. So this was post-operative day 1 following the intravitreal antibiotic injection, and post-operative day 3 following the injection. You can see that there is a resolution of the echoes and also reduction of the corneal edema. On the follow-up, corneal edema reduced, anti-chamber reaction decreased along with the intraocular pressure. B-scan ultrasonography also showed resolution of the echoes and the vision improved to 20/30. So in 2014, Gomez-Baster et al. Retrospectively reviewed 349 eyes of 216 patients with ICL implantation, reporting very low incidences of postoperative complications with only one eye presenting with TASS. Few reports of TASS after phakic IOL have been published, most of them from anterior chamber phakic IOL cases, and only one case report following ICL. So this study showed that the various causes for the TASS, like inadequate flushing of the instruments, use of reusable cannulas, inadequate manual cleaning of instruments, reusage of the single-use devices, touching of the IOL or patient contact areas of instrument with gloved hands, poor instrument maintenance, etc. So in conclusion, TASS is a very rare complication after phakic IOL implantation. Early diagnosis and management is essential to prevent long-term sequelae. And the most important step is prevention with adequate intraoperative manipulation of the ICL, surgical instruments, and intracameral fluids. These are my references.
If you suspected TASS, what?
Yeah, ma'am. There was that B scan showed moderate echo, so that's why we went ahead and gave it 1 dose of intravitreal antibiotics, ma'am.
Then would you call it TASS or endo?
Yeah, ma'am. Yeah, ma'am, it came negative. So initially there was echo, so we don't know why that was there. It reduced after 2 days, but suspecting it could be infectious, we gave 1 dose of intravitreal antibiotics, ma'am. But it eventually reduced. Although there is usually it is not seen posterior segment inflammation in TASS, our case had, but it was only very localized and it reduced after 2 days. Yes, ma'am. Yes, ma'am. There was few, ma'am. No, ma'am. There was no touch. Probably retained visco material was the cause. Yeah, ma'am. Because one of the study that Hernandez Bagandas, they did the study. They did ASOCT in the cases, and most of the cause for their findings was the use of powder gloves and the retained talc in the ICL. So they could see that in the ASOCT, the talc material. Yeah, ma'am. On the lens, ma'am, like dot-like things they could see. So that was not there now. So we suspecting probably it is retained visco material. Ma'am. Yes, ma'am. This one, ma'am. No, cohesive, ma'am. Yeah. 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 So,